Welcome. I'm Dr. Angela Mazza, a thyroid, endocrine, and metabolism specialist with an integrative practice in Central Florida. As our listeners know, my goal for this podcast is to define and demystify the thyroid gland and thyroid-related medical conditions. By providing information in an easy-to-understand format, I hope to help my patients better understand the ways in which their bodies work and to help them thrive. Dawn Sheffield, my co-host, has joined me for this important episode. We'll discuss Graves' disease and hyperthyroid, that's overactive thyroid, autoimmune issues, and possible treatment options for some patients. Thanks for being here.
And as always, I'm really glad to be a part of this. Hyperthyroidism, Graves' disease, and so many other thyroid and autoimmune conditions negatively affect millions of people. And I'm really looking forward to learning more about these subjects.
And we will, because today we have an interesting and informative interview with Dr. Eric Osansky.
His special focus on Graves' disease and other autoimmune and thyroid conditions came about when, in 2008, Dr. Osansky himself was diagnosed with Graves' disease.
Dr. Osansky is not only a chiropractic practitioner and a certified functional medicine practitioner, he also has a Master of Science in Human Nutrition and Functional Medicine. Additionally, he's an author, a lecturer, a frequent guest on various podcasts, a frequent featured speaker, and so much more. Dr. Osansky, welcome.
Well, thank you. Thank you so much to both of you. It's a pleasure being here and really look forward to chatting about hyperthyroidism.
Yes. And thank you for making time to be here today. We're looking forward to discussing your thoughts on lots of different topics.
Look forward to it.
So I've been your guest on your podcast a couple of times, which is called Save My Thyroid Project. I'm so glad you could be our guest today, discuss your own experience with Graves' disease, as well as your important work that you do for other patients. Well, we have some specific questions to ask to guide our listeners towards learning more about what Graves' disease is, your own health journey, as well as what you've done to help your own condition by utilizing a functional medicine approach. Just to refresh our listeners on what functional medicine is more holistic medicine. It's working to get to the root cause of what is causing what's going on, rather than traditional treatment, which oftentimes just treats symptoms. And we talk about integrative medicine a lot, which is really the combination of traditional as well as holistic. So let's get started with some questions, and I know our listeners are interested in.
Well, Dr. Osansky, having been diagnosed with Graves' disease, I feel like you have such a unique understanding of the disease. Would you mind describing Graves itself for our listeners?
Of course. So many people are probably more familiar with Hashimoto's thyroiditis just because it's more common.
Yes, I am.
Yeah. But and Graves, like Hashimoto's, they're both autoimmune thyroid conditions, but they affect the thyroid differently. So with Graves' disease, you have what's called thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody. And these antibodies bind to or stimulate the TSH receptor of the thyroid, and that causes the production, the stimulation of more thyroid hormone, and that results in a hyperthyroid state. You have elevated thyroid hormone levels, TSH, which is thyroid stimulating hormone, and pituitary hormone becomes depressed because pituitary is telling the thyroid gland to slow down the production of thyroid hormone. And so that's the main difference. What Hashimoto's, it's the opposite. Hashimoto's, you get damage, destruction to the thyroid gland, and then over time, the thyroid hormones become low, sometimes overtly low, other times subclinically low. And then because the thyroid hormones are on the lower side, you get the elevation in TSH. But those really are the main differentiating factors. Again, when I dealt with Graves, I had, and we could go into the symptoms, of course, but I had, as far as blood tests go, elevated T3, T4, as well as depressed TSH and elevated thyroid stimulating immunoglobulins. Some people do have antibodies for both Graves and Hashimoto's, but again,
I see that really, really commonly.
Wow.
Yeah, that is pretty common. So I don't want to go too far into that. But that's really, as far as the description of Graves, that's probably a real brief description.
Perfect. Yeah.
Thank you.
And I think it's a common misconception, I think, amongst patients where they say, I'd rather be hyperthyroid than hypothyroid. But having hyperthyroid symptoms is really life altering. It's not fun.
I'm one of those, as I confessed on a previous episode. I used to think that until I learned about Graves' disease and hyperthyroidism, and then I changed my tune.
Now, let me ask you, Eric, why were you so motivated to find a recovery plan that was based on functional medicine rather than just conventional medicine?
Well, it relates to my background. I mean, I definitely wasn't brought up with a natural mindset. I was brought up in just conventional family where if we were sick, we took an antibiotic. And again, there's time and place for medication, but it wasn't until I went into chiropractic school and that changed my mindset. And then as I was practicing chiropractic, I would always, for my continuing education credits, I would always focus on nutrition and functional medicine courses. And there were a few functional endocrinology courses, and I had no idea I would need those one day. I was just
Right, you never know.
exactly. I was just learning about them. And so when I got the diagnosis of hyperthyroidism and then eventually Graves', I knew that I was at least going to attempt a natural treatment approach. It's a attempt functional medicine approach. Now I had no idea if it would work because I knew of no one else who dealt with Graves' disease up until that point. But I figured, why not try to address the cause of the problem? Because typically, as you know, being an endocrinologist, usually when it comes to hyperthyroidism, there's three options: the anti-thyroid medication, radioactive iodine, thyroid surgery. And if I had to, I would have taken the anti-thyroid medication. I wasn't opposed to that, but I figured let's start out with an herbal approach as far as symptom management. And then while doing that, try to address the cause of the problem. And if I absolutely needed to take the medication, I would have been open to that.
Right, right.
Have you had to revise your own treatment plan over time, Dr. Osansky? And if so, in any significant ways?
Well, I mean, so I've been in remission since 2009, so it's been more of a wellness. I mean, just doing things more on a wellness basis. I will say that while I was dealing with Graves' disease, I mean, for the most part, it was a pretty smooth recovery, but I did hit some roadblocks. I mean, one roadblock is I was just some of my lab markers weren't improving,
Gotcha.
and then I modified my diet. So one thing they have now that they didn't have back then is autoimmune paleo diet, AIP diet, which again is not a perfect fit necessarily for everyone, but one thing that's excluded from AIP is nuts and seeds, which I was eating a lot of. And some people do fine with those, but I just decided let's take a break for a few months. And that really helped with my recovery. At least I think it could have been coincidental, but I'm
Right.
pretty sure that helped. And so that was a modification I made while I was healing and trying to get into remission. And then ever since then, I mean, I definitely have tinkered with different diets and different supplements. But again, it's been more that thankfully it's been more of just trying to maintain a state of wellness ever since then.
Thank goodness.
Wonderful.
Now, your book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, really an excellent functional guide to thyroid health in general. I mean, not just Graves and hyperthyroidism. I think you really cover a lot of really important ground. But you stress the importance of oftentimes combining conventional treatment along with natural therapies and that every person's different, which I think is true. I mean, I see that in my own practice. Because oftentimes, if you do combine in the beginning, you can take away the conventional treatment when it comes to thyroid medications for the most part, if everything gets back in line. So, what guidance might you give to someone who might have just been diagnosed with hyperthyroidism or even Graves' disease?
I mean, from a conventional standpoint or just
Just
overall,
in
or
general, like, would you say, hey, look at what's going on in your life as far as diet? You mentioned AIP. Would you be open, if depending upon how symptomatic the person was, would you say, listen to maybe your doctor as far as thyroid medicines as well as some herbal therapies, or kind of be open to anything in that realm, or just
yeah,
kind of
yeah.
look at what's going on? What's the cause? Was there stress involved?
I mean, so first of all, you want to be safe while dealing with
Yeah.
hyperthyroidism. So that's number one. And a lot of people I work with, they're already taking the anti-thyroid medication. So this is where combining the conventional and natural treatment methods come into play. Because if someone's on, let's say, methimazole and they're tolerating it well, And even if they were, I mean, I don't have prescribing rights, so I can't tell someone to stop taking the medication, even if I wanted to. But honestly, if they're doing fine on it, there's no reason for them to, to completely stop. Because the downside of taking something like bugleweed, motherwort, which is what I took when I dealt with Graves, is it doesn't work with everybody. With
Right.
the anti-thyroid medication, it's highly effective. The problem is side effects are common. But again, if someone is tolerating them well, they're not having symptoms, liver enzymes look good, white blood cell count looks good, then I think it's fine for them to continue taking the medication. Now, if someone is working with me, if they just start working with me, and if they're not doing anything, then again, it's ultimately up to them. But a lot of times when they're not doing anything, it's because because they're interested in taking more of a natural symptom management
Right.
approach, and then they might want to, take the bugweed motherwort. But I will say, and I'm not just saying this because of you, Dr. Angela, it's I do recommend working with an endocrinologist, at least initially going to an endocrinologist, getting diagnosed. And thankfully, most people, they're not going to me initially. They are going first to an endocrinologist, getting diagnosed. And that's why a lot of people are initially on the medication. And and either way, I'll say this, whether they're taking the medication or whether they're taking the herbal approach, with Graves especially, it's an autoimmune condition. So again, you want to try to do things to improve the immune system health while
Right.
taking the
That's the
meds
key.
or the herbs. Yeah.
Yeah, and even had patients who've been on really low doses of methimazole for years, and we've been able to get them off of it. So, I mean, that's kind of the key thing. When you go with something, we've talked about this before, that's more definitive, like surgery or radioactive iodine, you don't have that luxury. You can't like put the thyroid back. We can't take away the radioactive iodine's effects. So, um, I myself believe, if we can get people off medicine, the better. So, and the key thing is getting to that autoimmune kind of triangle. Well, and part of that is intestinal permeability. And we talk a lot about intestinal permeability or leaky gut on our podcast, a lot. And you have a chapter that's completely dedicated to the gut immune connection, which is part of the autoimmune triangle we always talk about as well. Would you say, in your experience, that most patients with thyroid issues have some sort of intestinal permeability problem?
I would say yes. I mean, I no longer test people for a leaky gut, which is that increase in intestinal permeability. But years ago, I did. If I don't know if you're familiar with Cyrix Labs,
Mhm.
they have their array number two, which is their intestinal permeability antigenic screen. And I had most people do that. Just it was new at the time, and it's like, yeah, let's test and see if people have a leaky gut. And most people did test positive, but I stopped recommending the test for a few reasons. One, I found that again, most people tested
Already have
positive,
it.
and so so just it's probably better to save them the money and have them not do that. And then two, it's not telling us what's causing a leaky gut. It's just telling them they have that
They
increase in
have it.
intestinal permeability. So yeah, why not spend the money elsewhere and try to find the triggers and underlying imbalances?
That completely makes sense.
You also have a chapter devoted to stress and the thyroid. How much of an effect do you think that stress triggers, or how, I don't want to say what percentage, but how much do you think stress really triggers a part in Graves developing?
It's huge. I mean, stress is a huge factor. Definitely was huge with me. And it wasn't just emotional stressors, but I was overtraining, which I should have known better at the time, but I wasn't listening to my body. So it could be both physical and emotional stressors. And I find the same with most of my patients, more so the emotional side, just that I'm stressed out because of my job or finances or whatever. But I also come across a good number of people who are exercising too hard and they're paying more attention to the emotional stress, just again, the stress associated with work or finances or
Um,
family, but they don't pay, they might be running marathons. And again, I don't have anything against marathons or triathlons, but
True.
again, like getting back to my situation, I should have known better, but and I didn't feel bad. I felt when you exercise hard, you kind of feel good, but anyway, so that's to get back to the original question. Yeah, stress, a big factor. And again, you said you don't want a percentage, but I would say probably like 80, 90% of people it is a piece of the puzzle. It might not be the main trigger in 80-90% of people, but at least it's something that needs to be addressed.
I just didn't want to put you on the spot, to come up with a number off the top of your head. But yeah, I understand.
But I mean, stress is definitely kind of the tipping point I've found in persons with especially Graves' disease. I feel like there's always some with my patients anyway, some big stressor that just like pushes the autoimmunity over the edge. And like even patients that I have with Graves' disease that are stable in remission, if something happens that's a big stressor, like a divorce or loss of a job, those antibodies start climbing up, and then that's where we have to kind of rein things in a little bit. But I completely agree. Our bodies don't know the difference between emotional stress and physical stress. We're just wired to handle both the same way.
Thank
Agreed.
you.
Now, I do have to mention you have another new book that's available called The Hyperthyroid Healing Diet: Reverse Hyperthyroid and Graves and Save Your Thyroid Through Diet and Lifestyle Changes. I can't wait to read this. So what natural therapies are your go-tos to start with when dealing with patients with hyperthyroidism?
Well, obviously diet is one of those. And I should say that the title of the book is a little bit misleading because there's not a single hyperthyroid healing diet. It's, even though I mentioned before AIP, it's not like the whole book just focuses on one diet because everybody is different. But I think what we all have in common as functional medicine practitioners is recommending whole healthy foods and trying to avoid refined foods, sugars, unhealthy oils. I mean, some people will differ. Some will recommend more of a carnivore diet, others like a regular paleo diet, others a paleo diet. But again, what these have in common is they're still focusing on the whole food. So diet, just like stress management, an important piece of the puzzle. A lot of times cleaning up one's diet alone isn't the answer. Although I'm sure you've seen there's people that just go gluten free alone and they notice a big dramatic improvement in their health.
Right.
And then, yeah, so it really does depend on the person.
It really does. And everybody, I think that's the beauty of it, is it's personalized medicine. Functional medicine is personalized medicine.
I never thought of that.
Yeah.
That's absolutely correct. That's a good point. Dr. Osansky, you share some very important information on a regular basis with your podcast, Save My Thyroid Project. And it is good. I've listened to a number of your episodes, and I've just gotten a lot. I've gotten a lot out of it. I just discovered an episode today that I must listen to next. What inspired you to take on this project?
Great question. So for years, I was just writing articles. If you visit, so my first website, naturalendocrinesolutions.com, which was created in 2010, and that's just articles. I was just writing articles, blog posts related to hyperthyroidism as well as Hashimoto's. And so there are a lot of thyroid related podcasts, and including this one that that Dr. Angela has here. And most of them have more of an emphasis on hypothyroidism and Hashimoto's. And so when I came out with Save My Thyroid, the goal was the opposite. The goal was to have more of a focus on hyperthyroidism Graves. So if you listen to the episodes, I mean, you'll notice most of the guest episodes focus on both, just because there's not a lot of practitioners out there who focus on hyperthyroidism. So that's the reason for that. And then the solo episodes are a mixture. Some of them will benefit people with both hyperthyroidism and Hashimoto's, but then you'll see dedicated hyperthyroid episodes where there really aren't dedicated Hashimoto's episodes. And it's, even though I wrote a book, Hashimoto's Triggers, I still focus primarily, like I'd say about 80% of my practice consists of people with hyperthyroidism. And again, just because there's not a lot of information out there in general, let alone on podcasts with hyperthyroidism, I figure that this one will focus more for those people with hyperthyroidism, including Graves and other hyperthyroid conditions.
Yeah, and there's definitely a need for it, because I feel like I'm seeing more and more patients with hyperthyroidism and Graves' disease. Whereas I think, just like you said, we kind of just, oh, it's more Hashimoto, but there's a lot of Graves' disease out there. And actually, I've had a couple of, just within the past year, a handful of patients who have Hashimoto who started not needing as much thyroid medicine and they weren't doing anything differently. And it turns out they started developing thyroid stimulating immunoglobulin. So I mean, because why would we check TSI in someone with Hashimoto thyroidism? I mean, so we're seeing it's the autoimmunity is the key thing and it can switch. So yeah.
Oh.
Yeah.
And
No, go ahead.
so as far as your podcast, I don't want to get off of that too far. You've had some really diverse topics and you kind of alluded to them. What have kind of been some of your favorite memorable, you kind of look back and say, oh, I really like that topic, or that's outside of your normal that your listeners really responded to, you got great feedback on, or anything in particular?
That's a good question.
Yeah.
One of the more popular ones was on castor oil packs.
That's a big one. Yeah. You see that?
I didn't
I have
see
patients
that
ask that a lot.
Yeah, and I had to get it wasn't a solo episode. It was just because again, I don't consider myself to be an expert when it comes to castor oil packs. So I'm like, I'm gonna find someone who's more of an expert than I am. And and I had Carrie Vitt on, and and she spoke about castor oil packs. And then more recently I had an episode with Kelly Kennedy on lymphatic drainage, and that was really popular as well. So just because you don't hear as much, you hear a lot about liver detox and of course, stress and adrenals. I mean, they're still fascinating, and I still enjoy, of course, every episode, every interview I have. But those were two unique episodes where a lot of people were really interested. And if you visit like the YouTube video, you'll see a number of comments as well with both of them. Just found people finding both of those very interesting
because they're unique topics that you don't hear about a lot. And I can't tell you how many people ask me about castor oil packs.
I've never
I really
tried that before this.
Yeah.
Wow.
So, and for our listeners, I want to stress two really important points. And I know Dr. Eric agrees with, is that one, and you do stress this in your book, try not to diagnose yourself or treat yourself. That really can be deadly and dangerous. And, find healthcare professionals like yourself that can help out and give you guidance if you're looking for more of a functional approach. And two, you got to trust your instincts if you're not feeling well. If you feel like a diagnosis or treatment plan isn't quite right for you, then find someone who can help you. But I think the key thing is you don't want to go it alone, because unfortunately with Graves' disease, for some people, they can be pretty unstable. So you want to find the right course of action the safest way as possible. So Dr. Osansky, where can listeners turn to get more of the important information, you've kind of talked about today?
So you mentioned my books, especially the ones with hyperthyroidism, natural treatment solutions for hyperthyroidism and Graves' disease, as well as the hyperthyroid healing diet. And so both of those, you could just go on Amazon, probably the best place.
We're going to have all that in the show notes too.
Okay, great. And then you mentioned a podcast, Save My Thyroid. So it's savemythyroid.com. You could find that. And then I mentioned Natural Endocrine Solutions, which it's weird to have two websites, but the first one was just focusing on the blogs and articles. And then when I decided on the name Save My Thyroid, it was just I just love the name. And I'm like, it really deserves its own website. So exactly. So that's why there's a separate website for the podcast and a separate website for my articles and blog posts.
Perfect. Well, is there anything you'd like to kind of tell our listeners that we haven't covered?
Not really. I mean, I think we covered the important points. So as we both mentioned, you want to be safe and you want to have guidance. I mean, a number of people will send emails asking like what dose of buckwheat to take or motherwort, which suggests that they're really not taking the medication and not doing anything and just trying to self-treat their condition. And so really, whether you take obviously if you're taking the medication, you're going to be working with a practitioner. But even if you decide to do something naturally, it's a good idea to work with someone because, like you said, hyperthyroidism, there are risks involved, and so stay safe, but at the same time address the cause of the problem, whether you have Graves' disease or a non-autoimmune hyperthyroid condition.
Exactly. Well, we so appreciate your time today. Thank you so much. Please keep continuing to do the good work that you're doing and spreading important information for people out there who really, really need it. So thank you.
Yes, I really appreciated getting to meet you. You are just a great guest, and I'm very grateful for your time. Thank you.
Well, thank you. Well, you were both wonderful hosts, and it was a pleasure being interviewed by you. And just, hope your audience learned a lot about hyperthyroidism.
All right. Well,
There you
thank
go.
you so much.
Thank you so much. Bye-bye.
Thank you.
I wanted to do this podcast to provide life-saving education and to encourage folks to see a doctor in time to prevent or minimize damage. That's deeply fulfilling. I enjoy helping people understand how all aspects of their lives are tied to both thyroid and overall health. As always, my goal is to help us live more fulfilling lives by taking control of our health and thus feel our best. In fact, that's why I went into endocrinology. It's a medical art that combines science with the study of our lives and all that they encompass. So for our next episode, number 30, I'm talking 30, we are covering GLP-1 drugs. They're used for both diabetes and weight loss. What are they? How do they work? What's being discovered about them? People have lots of questions. So send us your questions now so we can address them.
Right. That would be helpful. And for more information on Graves' disease and hyperactive thyroid on this podcast, refer to our episode number 3. As always, we hope our listeners will continue listening to Thyroid Talk with Dr. Angela Mazza. We have many more interesting episodes and guests planned. We'll build on today's foundation and cover many topics we hope you'll find meaningful. And now just to recap some of what we covered in this episode, not necessarily in this order. What is Graves' disease? How is it diagnosed? Graves is an autoimmune condition. Why some might choose functional medicine versus conventional methods for Graves. Some patients thrive with conventional treatment techniques and pharmaceutical medications. Others may benefit from a functional medicine treatment plan. A combination of the two may be most appropriate. It depends on the patient. We brought up leaky gut and the impact stress might have on triggering Graves' disease and various autoimmune conditions.
And just to remind our listeners, anti-thyroid medications, these are traditional medicines that help tone down the effects of an overactive thyroid or tone down the production of too much thyroid hormone. That's just a reminder because it's been a while since we talked about that.
I'm really glad you mentioned that too, because that term could be really confusing.
Yeah.
Anti-thyroid is like kind of scary.
Yikes.
And best of all, we learned that we can impact our thyroid health. As Dr. Mazza mentioned, in our next episode, number 30, we'll have a discussion of the class of medications known as GLP-1 drugs used for both diabetes and weight loss. Dr. Mazza's book, Thyroid Talk, an integrative guide to optimal thyroid health, is now available on Amazon. There's an online master course related to the book to help guide us to optimal thyroid health. It's initially recorded online live, but is also available for subscribers to watch on their own when convenient. Participants can share their questions and concerns if they want to, optional, and get customized information on how to work toward healing.
And I think the live episodes are the live stuff is really the kind of the best stuff on them.
I do too. I really like it.
We call them the live coaching sessions. But I also
Yeah.
do really well as a learner when I can have things to watch at my own convenience.
I do too. And every single one of them I've written, go back and watch this again because it's a lot. It's a tremendous amount of information and all of it really helpful. And so, yeah, I have to go back. And there's several now that I may have to go back more than once.
You can go back as much as you want.
That's the very nice thing about that.
So the online course helps us walk the talk to energize our lives.
For more information, you can check out thrivethyroid.com or forward your name and email to thyroidtalk.mazza@gmail.com. You can also reach out to Dr. Mazza's website, metaboliccenterforwellness.com.
The initial webinar coordinates with the online masterclass. The masterclass has modules that cover topics like diagnosis of thyroid issues, like is your thyroid in crisis, personalized treatment, gut healing, and much more. Plus some bonuses. I don't want to share what the bonuses are.
The bonuses are really good.
Okay.
Yeah. Don't give it. I don't know. Don't maybe not give it away. I'm pretty excited about one of the bonuses, that's coming. Now, and as you know, I always feel the time that you put into it is so valuable.
You're too sweet.
Well, it's kind of surprising, actually.
Well, thank you, Dawn. So for information on at least some of the supplements we may discuss on the show, please visit the wellness store at metaboliccenterforwellness.com. Full disclosure, I personally use and I carry supplements by Douglas Laboratories and Pure Encapsulations in both my office and at our online site. Please stay in touch. Check me out on my YouTube channel, the website at metaboliccenterforwellness.com, as well as Facebook, Instagram, and TikTok.
There you go. We welcome your input. Please submit your questions, comments, and show ideas to thyroidtalk.mazza@gmail.com. That's an email address. We may disclose your general location on air, the city or town, for example, but we will not read your name nor your address on the show. We reserve the right to edit your input as necessary. And just briefly, Dr. Mazza has a medical staff right here on site, of course, while we're working on the show, but they do not work on it with us. Dr. Mazza, they have many other important duties. Dr. Mazza has to carefully carve out time just to do the show. And she's the technical person and the editor, too.
You're giving me way too much credit.
No, what's just true. I don't have anything to do with that. And thank goodness you do. So although we receive your questions and comments like they are gold, we can rarely respond personally, and we sure wish we could. So please know your input is greatly valued. And finally, please don't forget to ask your healthcare provider any specific questions regarding your wellness. This podcast is meant for educational purposes only.